studio, we have Miss, is it Miss or Mrs.?
Yes, Miss, you're marrying me off.
I'm speaking.
Tell me who he is.
I'm speaking futuristically, you know.
Love it.
And she's the IHO project manager. Britney, thank you very much. Thanks for joining us. If you do need extra time, we will allow you extra time because Britney was supposed to get 30 minutes, but sometimes you just can't get away from conversations. But I'd like to welcome you. Is this your first time on Connecting with Dave Lesser Payne with Alicia George?
Yes, it is. It is. But it's not my first time with you.
It's not. When I saw you, I was like, I know you.
Yeah, we're connecting in different spaces. And that's beautiful.
No, I want you to tell us a bit before we go into the walk that we're going to talk about. What is IHO? What does IHO do? IHO do? What is your mandate?
Wonderful. So Integrated Health Outreach, IHO, is a nonprofit organization based in Antigua and Barbuda, and we focus on the empowerment of women, looking at gender equality and also youth empowerment, looking at the environment, our ecology and livelihoods, and how we can improve the status of persons in Antigua and Barbuda. And also we've branched out and connected with our regional partners and also looking at other ways that we can have a collaborative spirit. And so within that context, we are currently working on several projects that improve, again, the livelihoods of Antiguans and Barbudans and also the Caribbean region, because without each other, we wouldn't be able to survive and have the resilience that you were speaking about in your previous project. Or program.
One thing I know about IHO is that it's community-based in that you go into the community. So you don't have anybody telling you anything. You don't have, specifically online surveys. You know what you're talking about because you're speaking with the people at the heart of the matter. How easy or difficult has it been to get people to probably come to meetings or to get them interested in the work that you do? Great
question. So it's a mix. We do complete literature review. We do rely on the regional surveys that have been done by both international and regional entities throughout the Caribbean region, because we do have those hubs and different observatories that focus on different issues. So we're very grateful for that information. And even right here, I have a research brief that was done with the support of UN Women and the Caribbean Development Bank. But you're right, we do have a focus of going in and connecting with the community and not just waiting on people to reach out to us as an organization, because that makes sure that we're not disenfranchising anyone, and those that are already disenfranchised do receive the support that they need, that we're able to connect with people who may not be able to complete an online survey, that they may not have data on their phones, for example, that we give them a safe space to create and also to express their opinions and beliefs and the experience that they've had across the different areas that the organization touches.
And why did the organization feel it necessary to reach out in that way?
Because of the disenfranchisement, because you aren't able to truly capture what the experience is. So, for example, the impact of the food security. So what impact we need to have within the agricultural space. And that's another project that we have coming up as well. But being able to connect with people is so important. Like, yes, we're in the digital age and I'm very much a techie, but you have to be able to, again, create that safe space where communication happens and not just rely on who comes to your door. You have to be able to go out and people to recognize your face, your organization. And that's where you're able to collect data with accuracy, right? Because then the information is skewed to maybe one particular demographic that can come in and report and to do the surveys. People, again, with internet access, who are already aware of your organization. But in this way, we have our connections through whether it's faith-based or sports, and, just connecting with the different community groups is very important to us so that we can have that accurate information.
And is IHO only responsible for Antigua, or do you reach out regionally? Do you have other projects in other countries?
Yes, so we are focused in Antigua and Barbuda. That is where we were founded, but we do have a lot of regional partnerships, and we work with other organizations that are based in different countries to complete regional projects. So we would perhaps connect with a consultant that's based in, let's say it's Dominica, for example, who can complete that work on the ground. But we definitely have a regional focus, and again, it's to tie back into the issues that we're facing as a people within the Caribbean are not isolated to any one island or territory. We're all experiencing it, and that's where we would have decided that we were looking for information on gender-based violence throughout the Caribbean, and there's limited information. So the surveys that have been done maybe target about 5 countries, but Antigua and Barbuda was not included. There's not as much information maybe on Dominica, St. Kitts, and so we want to be able to have an accurate picture of what this issue is and the impact that it has on livelihoods, on our workforce, and the human experience that women and men have.
And of course, those are some of the behind the scenes aspects of economic growth that people don't see.
Exactly.
The collection of data, how do you apply it? And you're absolutely right where you say, I like to say we've lived the same lives in the Caribbean. And you see it a lot now on social media where you have some of the comedians, they're acting out different scenes that their mother or their father used to do. And I was like, were they living in my home? Did they have a camera in my living room? Because although we're in different countries, we seem to have the same type of interaction.
And for those of us who may have been fortunate to travel, maybe through a conference or through a camp or anything like that, and so your first time in, for example, in St. Kitts and Nevis was the first time I went to another island outside of Antigua, and it was with other Caribbean youth, and it was amazing because we were saying the same things, maybe, the persons who could speak Creole, it was a little different there, but we had very common experiences. We had the same things about, taking the little piece of meat out the pot, and trying to cover it back, and it would suddenly make all this noise. But just little experiences like that were able to translate and build your connections. So you find that Caribbean people, even when we go away to study at university, or if we're pulled together for a sporting activity, then you find that we're able to relate to each other. And so the same thing is true on the issues that may feel uncomfortable to discuss, which is including gender-based violence. So whereas of course we can talk about traveling and going to school, it's the same experience that we're seeing also, and the Caribbean is number 2 in the world for gender-based violence. That's the ranking because of our population size, right? So it is an issue that is impacting us, and the reason for us also having the walk is that we want to raise awareness and show solidarity with the persons who would have experienced gender-based violence, because within our communities it's sort of taboo to talk about, right? And so here it is, we will be empowering people to report and to seek services in that regard, because we're making it an issue that is brought into the public and highlighted.
Right, and now the walk, I have the flyer up there. The walk, the 5K walks, that's, it's on March 9th from 3 p.m. at the Botanic Gardens. So can you tell us a bit about the route that they be taking, the purpose of the walk, who are you expecting, and, how can we all get involved?
Yes, definitely. So just to backtrack a bit for you, though, we are having the walk both in Antigua and in Barbuda, right?
On the same day?
No, not on the same day, because we want to make sure that we give the same level of quality for both events. And so it is in commemoration of International Women's Day, which is March 8th. So hopefully you invite me back to your studio for that day. I'm just putting my slot in. And so we wanted to make sure that we recognize and demonstrate that this is an issue that impacts both of our island states. And so in Antigua, it's March 9th at 3 p.m. We're going to be at Botanical Gardens, which is also a place that is omnious, right? It's location where persons would have lost their lives or feel unsafe, to walk through. I remember going in high school, and it was just like you got to go with a group of friends. You don't really want to walk alone.
It's kind of tough.
Depending on where you're traversing through the area. So it's also where we plan to call the names of persons who have been impacted by gender-based violence, that who would have lost their lives, and these are things that are public knowledge based on the reporting that's been done by our media. But then in Barbuda, it is on March 16th, and that is also a Saturday, and we will be publishing the information, the specifics for it, but the walk will be around 10:30 or 11 a.m. And we, of course, encourage everyone in Barbuda to turn out and support for that event as well.
Right. So it's a Saturday, so you have absolutely no excuse.
None.
As to why you can't support it. And of course, it starts at 3 p.m. in Antigua. What time does it start in Barbuda?
In Barbuda, we should be starting at 11 a.m.
At 11 a.m. Now, what does gender-based violence look like? I know a lot of times we feel like, okay, well, it's just somebody thumping down the other person. But there are a lot more aspects. Yeah. What is gender-based violence?
So that's often the side of gender-based violence that gets highlighted, like just sexual violence and the physical interaction that happens. But it's much more than that. It's also, and even by definition, it's exerting power over the other gender because you have the opportunity to, the ability to. So that's where like the strength, the show of force happens, and it takes many forms as well. So it's psychological, it's mental, that it can happen, as well as emotional and financial. Because if one person within, let's say, a relationship, because intimate partner violence is a significant risk factor for persons, and so within that dynamic, if the breadwinner is withholding funds so that you can't go to the grocery store, so that you can't purchase clothes, so that you don't have your basic necessities or anything that you are accustomed to, then there is a level of financial hostage, so to speak, that you're being held, and that is gender-based violence as well. So we often focus on, yes, the sexual violence, but even in your dynamic of your relationships, whether those are romantic or platonic, you do have to analyze and really assess how this interaction is, because it can take the psychological form where persons are making you question your sanity, and or playing mind games and making you feel less than, and causing depression and other factors, other emotions that come from it. So all of that is gender-based violence, and we don't really speak about it, because then when someone says, oh, your partner is maybe like nagging at you or cursing at you, it's just, oh, you're strong enough, take that. We have our way within the Caribbean that we deal with it, and it's based on the culture, and so it's also a cultural shift that needs to happen, where not only are we highlighting and discussing it, but we acknowledge that this isn't right, that I can take myself out of that dynamic and I deserve better. I can seek support services. And the Directorate of Gender Affairs has services. It has a hotline that you can call. It's 24 hours. It's 463-5555, so 4 5s. And you can also WhatsApp them as well.
Okay. Now, gender-based violence, can that take place in a family setting? For example, a son and a mother, is that still considered to be gender-based violence?
Yes, like if the characteristics are present, then yes, it can happen in any relationship dynamic. So it can be within a parental relationship, and then that's where you'd also seek the services of like child welfare, social services as well to find that support, because you have a parent, so you need to be able to create that dynamic for the child to speak up. And so they have guidance counselors within the school system, or perhaps if they're able to access like faith-based resources, so speaking with, a mentor, then they're able, we want to create those safe spaces for people who may not be in what we as society consider like traditional gender-based violence acts, to be able to speak with those who provide those safe spaces. So that's very important as well.
And that leads me to my other question. Gender-based violence, has it traditionally been male and female? Is that a characteristic of gender-based violence? Mm-hmm. So, and I'm asking, because I know this is going to be a long-form answer. I'm asking specifically because we now acknowledge within our society, although it's not, on our books legally, we now acknowledge same-sex partnerships and so on. Does then the characteristic of gender-based or gender-based violence have to shift or move, or does it already encompass that?
Mm-hmm. Yeah, great question. So just going back to the definition, right? It's that you're in an unequal power dynamic. Okay. And it could be within different relationship types. So again, platonic or romantic. It could be, and we know that there is abuse that happens between men to men. Mm-hmm. So I think that answers your question there. So even if it's platonic, right, it can happen. Even if it's romantic, it can happen. And so the issue then is, because of how our society is formulated, how we move, what our cohesion is, and the sociology of it, there is a lack of reporting, because then we feel that maybe there's a lack of confidentiality if I speak out against my parent or speak out against my partner, and then there aren't the safe spaces. So we have to create those safe spaces regardless of what we maybe traditionally think has gender-based violence. So it's very important for activities like this walk and for our entire community, the entire country, to come out and support and demonstrate that this is something that we don't want in our communities. We don't want sexual-based gender violence. We don't want emotional or psychological-based gender violence. We don't want it to happen even in the form of human trafficking. That's a form of gender-based violence, because you're holding someone maybe hostage based on their migration status or their economic status, that they don't have enough income to move to the next level. So you're able to capture them and move them from place to place. So it happens, and it happens somewhat in plain sight. Like I've heard, for example, couples arguing, and you think that that's okay, but it's not. It's still,
especially in the Caribbean. You're just like, yeah, leave it.
Exactly. So that's why we are championing this. We're supported again by the Directorate of Gender Affairs, and then we also receive such amazing support from our partners and our donors through the Equality Fund. They're assisting us with this project and this walk, and we're seeking, of course, our local businesses as well, and local entities, local communities to come out to get their persons registered. You do receive a free swag bag, which has a t-shirt with facts, like statistics on gender-based violence, so that you can be a part of the movement.
So then, you mentioned earlier, so part of what's going to be happening on Saturday, March 9th, is pretty much like close to a Say Your Name campaign, because you said you're going to start off at Botanical Gardens and you're going to, begin to call the names of persons. Has the organization perhaps reached out to the family of those persons? Are they getting involved? Who can we expect at the walk?
Great question. So we haven't spoken directly with families, especially because we want to be sensitive that they may not want to relive their trauma, right? And so I think it's based on what's made public, what has been public. And so, for example, we have our IHO GBV Coalition group where we see what is published within the media, and we're making note of that. We're going back historically to find the names of persons who would have been impacted by gender-based violence, and those are the names that we would be calling, because if we don't, we're just keeping it hush hush and like under the rug, and it's a reality that we face or someone within our sphere could be facing, and we want to find ways to speak with them and have those conversations. So we'll definitely continue having more events and more activities, trainings and workshops. One of them that we had was with nurse Alexandrina Wong for Women Against Rape, and she did a training with our coalition so that we were able to understand what the current status is in Antigua and Barbuda, but also regionally. And it is that there's a lack of reporting as well, has limited services for persons. Some of the questions that we ask focus on what happens if you're experiencing gender-based violence and you have to go to work the next day. Like, what does that dynamic look like? Are our local businesses or even the multinational companies that come here, are they making any kind of action towards having a gender policy within their organization? So these are the discussions that we need to have, and it's only when we're all at the table discussing it and creating that input channel that we'll be able to see tangible actions.
Yeah, and you're absolutely right. And you mentioned that a form of gender-based violence may also come in human trafficking. And I have been doing some research on that for a separate project. But the question came up during it, well, how does the media report on human trafficking? Does it differ from other areas, or does it get convoluted with other things? And I suppose the same can be said for gender-based violence. So we only report it when something happens, and then we talk about it for 2-3 days and say, well, this was horrible, this happened. And then that's it. And so I think the walk on March, is it March?
Yes, March 9th in Antigua.
Bringing a focus to that in a way. And I hope that we can be there with a video camera.
Please
so that
you
people feel the type of impact. Is there any registration? Is it free?
Yes, so it is a free event. However, we do ask you to register so that we can plan appropriately. The registration link can be found on the Integrated Health Outreach Facebook page, IHO, and you can also connect with us on Instagram, IHO_AB. That's our Instagram, and you'll be able to find the link in our link tree. So it's important, again, to show solidarity, find someone to go with you for the walk. It says 5K, but it's not that long. It's like maybe 3 miles, I promise. We'll be able to walk, and the time will go by so quickly, because when you're passionate about something, you just move at light speed. So we'll have a great atmosphere. We'll have banners and to show solidarity with persons who are experiencing gender-based violence.
So where does the walk end? We know it starts at Botanical Gardens by the big tree.
Yes, by the big tree, and it ends back at Botanical Gardens. So we're making a loop. So we will return back at Botanical Gardens and have a get-together where we'll be able to connect as well. And persons are encouraged to join the IHO GBV Coalition WhatsApp group. We continue to send out emails through our server and making sure that you can connect with us on different activities. We'll also have some Facebook Live interviews coming up with Nurse Janita Cuffey and Tulip Lee from Barbuda. They'll be coming on Saturday at 10:30 a.m. to discuss gender-based violence issues with us from a Barbudan perspective. And then also we'll have some legal perspectives throughout the month as well, because it's very important to understand, like, if I'm experiencing or know someone who's experiencing gender-based violence, how can I assist them, or what can be done, what's the channel that we take. It's very important to know that, because you're empowered at that point, and that's what integrated health outreach wants
legal
for our
perspective
community.
Is it like a one-on-one chat? For example, if I have a question, I know what people are thinking, but if I have a question, how do I get to ask? Is it a special session? Do you take questions afterwards? What if somebody's shy and they don't want people to know, okay, I'm looking at this on Facebook? Like,
okay, great question. So we will be able to have it in a webinar. A webinar.
We should rename it webinar, though.
Right, I like that.
Webinar.
Oh my, okay, make a note. A webinar format where we'll be able to take questions anonymously. They will have that opportunity, but we will have some specific questions based on the interactions that we've already have for our guests, so that we can ensure that the information that needs to get out is processed and available for persons.
Okay. Unfortunately, we have to say goodbye because we have our next guest, but I want to give you another opportunity, a last opportunity, to tell people about the walk, where we meet, and what we're doing. And I'm saying we because I'm hoping I can be there too.
Yes, you're definitely welcomed, and so is, of course, Observer. We want to make sure that we get great media coverage so that we can highlight that there is solidarity in the media. And before I go to the walk, you're totally right in that how we present the victims of gender-based violence in our media is important. We don't want to see, oh, well, what was she wearing? Or, they deserved it, or they instigated the issue, and without the facts being there, right? Because then it creates a situation where those who are victims feel that they can't report, because then they'll be publicly shunned, and it's a permanent record within the media. So again, the walk is happening both in Antigua and Barbuda. So in Antigua, it is March 9th at 3 p.m. at the Botanical Gardens. You'll get a free swag bag with your t-shirt to wear. So we'll have our distribution information up shortly. Please do register by going on to the IHO Facebook page. You'll be able to find the link there on our flyers and on our Instagram, IHO_AB. In Barbuda, the walk will happen on March 16th at 11 a.m. And again, you will receive your free swag bag, and the registration will be made available. So we're looking forward to as much community support. And specifically, we want men also to know that they are part of the solution. We know that we can't do it alone as women, and also men are impacted by gender-based violence, and our communities are impacted by gender-based violence. So we want to see our men present, front facing, carrying the banner, the torch, so to speak, and showing that they stand with the women of Antigua and Barbuda as well in solidarity.
All right, Britney, I'd like to thank you very much again.
Thank you.
Britney McDonald, the IHO project manager. We were talking about a walk that will be happening in March, on both March 9th and 16th in Antigua and Barbuda. We have to take a break now.